And happy Friday. Thanks for being here on this sunny Friday day. We're going to let folks enter the meeting. I know folks are joining right now. See a lot of familiar faces. Thank you again for being here. While we're getting started, if you don't mind putting your name, title in the chat, and if you desire, feel free to share any relevant share outs. Great. Welcome, everyone. I'm Jamie Feld, Director of Opioid Response here at the Colorado Attorney General's Office, joined with our phenomenal team at the Opioid Response Unit. Today, we're going to go over a variety of aspects that pertain to the Colorado opioid settlements. We'll go over the settlement framework and the Colorado MOU, approved purposes, the Colorado mission and guiding principles, transparency and accountability, and then finally touch on the infrastructure and state share funding opportunities. We do want to have some time for questions, so we'll keep this first part fairly brief in order to allow time for questions. Additionally, feel free to put questions in the chat or raise your hand at any time. Next slide. Some housekeeping is that this presentation is being recorded and will be available afterwards. This is the first of multiple 101s that we're hoping to do. We know that there wasn't as much notice for this one, so we want to do it throughout the year. So if you have other folks that want to get engaged, please know that there will be more forthcoming in 2026. And then please raise your hand for questions or put them in the chat. Our team will be monitoring the chat as well as providing resources. We wanted to start with some good news for 2024. That is, we are starting to see a decrease of about 14% in fentanyl overdose deaths in Colorado. We know that this is the start of some promising uh, trends. However, there's still so much work to be done. But we wanted to start just with the good news that many of you are doing this work on the ground and we are starting to see its impacts. Again, we know this is a multifactorial issue that there are multiple drugs in the supply, but we are hopeful that the combined efforts from all of you at the county, the regional levels are making a difference in saving lives. With the next slide, I'm going to turn it over for Jack Patterson, our operations administrator, to share more substantially about some of the details of our opioid settlement.
Thanks so much, Jamie. Hi, everyone. Yeah, as Jamie mentioned, my name is Jack Patterson. I'm the operations administrator with the Opioid Response Unit here at the Colorado Attorney General's office. So, when we talk about the opioid settlements, we are talking about actually quite a large number of settlements. At this point, it's over 20 different settlements collectively that are being managed through this kind of shared model. We started seeing these funds started, the first settlements were paid out in 2021. That was the McKinsey settlement with the state of Colorado and some other states. And then kind of in 2022, they really started rolling with some of the bigger ones with the big three distributors, which are that 312 million, that largest pool pot share of this $880 million pot. But then in subsequent years, we've seen additional settlements with parties like Walgreens, CVS. Most recently, you may have seen the new settlement with Purdue, which just finalized, and local government signed on to that this year. And so as you can see kind of with this chart on the right side of the screen, you can see there's a lot of different parties ranging from the pharmacies to the distributors, the marketers to the consultants kind of involved with exacerbating the opioid crisis here in Colorado and across the country. So state attorneys general, as well as various local municipalities, all kind of recognize the harms committed to their communities by various actors and started pursuing various litigation kind of over the last decade, which really picked up kind of in the late 2010s. As these kind of settlements at the national level started coming to kind of fruition and started kind of becoming more clear, it became clear that Colorado needed a structure to manage opioid settlement funds at the state level. And one of the things that was required was to bring together the state and local governments because basically each of the national settlements was seeing different suits from all the different states as well as from different local governments, such as the city and county of Denver, city of Boulder, the county of Boulder, for instance, right? All may have had separate lawsuits. Not all of those parties may have had their own separate lawsuits. But basically, rather than having everyone, all the different states and different municipalities and counties sue separately, there was a recognition of an ability to kind of join these suits together to maximize the funds received from these parties. And so one of the things that was required was to bring together the state and the local governments into a shared agreement as to how to distribute Colorado's share of the funds. And so that's where the Colorado Opioid Settlement Memorandum of Understanding came from. So this is an agreement in 12 local governments. So that includes all 64 counties here in the state of Colorado, as well as 248 municipalities, which basically means the entire state of Colorado's population is nearly covered by this population. Less than 1% lives in municipalities that are not participating in the MOU. And so what this agreement did, well, it did a couple of different things, right? So it helped kind of settle that, kind of bring together the states. And so part of the agreement required the local governments to join the state lawsuits. So that is kind of that signing on to each of those individual settlements that you have seen over the last couple of years with the local governments, right? So rather than separately suing, kind of joining this big multi-district litigation. It also set out kind of a distribution structure of how these funds would be distributed across the state of Colorado, right? Are these funds going to be distributed kind of, are they all going to go to the state? Are they all going to go to local governments? Kind of what is that distribution model? It also set out kind of what's the reporting structure and kind of how these funds were reported on and how is the public made aware of how these funds are set out. And so it includes some reporting requirements. And so this agreement really is kind of the heart and soul of kind of Colorado's model for how opioid settlement funds will be managed through the kind of whole payment cycle, which currently is through 2041 with the new Purdue settlement. So we talk a lot about kind of what was the kind of the core goals of the opioid MOU was one, it was to maximize the funds received. So right, so how do we bring most local governments and states together and the state together to maximize the funds received because the settlement parties paid out more if there was greater participation from the state and greater kind of and basically less risk of individual lawsuits. Uh, so that was one goal was to maximize some funds received by the state. Second, and to maximize their impact as well. Second was how do we utilize the existing infrastructure to the extent possible, right? How do we kind of utilize existing partnerships and structures to allow us to kind of maximize the impact of these funds? And third, how do we ensure equity for all local governments? We know this crisis has impacted communities in every corner of our state. And we know that there are critical needs across our communities to invest in the services necessary to abate this crisis. And so how do we kind of set a model that doesn't ensure too much kind of top down or centralization of funds that allows for these funds to kind of get out to communities? So Colorado has a model which sets out four shares, and so a lot of states actually don't have. I actually not, to my knowledge, Colorado is the only state with four shares. Most states have two or three shares. A lot of states basically split the funds directly between states and local governments, where it'd be about, a lot of times kind of 50-50, 40-60, something like that. Colorado's model is very different than the rest of the country. Colorado has a model that is really driven by a regional driven model. And so as you can see that 60% of the funds are allocated to the regional share. And what that means is that there are 19 regions here in Colorado that were self-formed. And I'll actually go to the next slide so you can see those 19 regions that were formed by the MOU. And so most of the funds are managed by these 19 regions. So each of these areas has their own opioid abatement council. I know many folks on the call may be members of their local opioid abatement council or involved with their local opioid abatement councils. So the majority of funds, over 60% of funds, is allocated to the regions by default per the terms of the MOU. The next largest share is the local government share. So each of the 312 local governments that signed onto the MOU had a direct allocation available to them. However, they actually had the ability to redirect this share to their region. And so actually over 80% of local governments chose to direct their funds to their region. So kind of proportionally speaking, it's actually a bit over 70% of funds are being managed by the regions and a little less than 10% of funds managed by the local governments. So we've really seen an investment in this regional model. The final two shares are 10% is received by the Colorado Attorney General's office as the state share. And you may have seen kind of there have been various statewide funding opportunities funded through that state share, as well as various statewide initiatives, as well as funds to Colorado's federally recognized tribes. And then the final share is a 10% infrastructure share, which is a share that is really unique to Colorado, which was a portion set aside specifically to meet the unmet infrastructure needs and to provide operational assistance across the state of Colorado to supplement the other shares, right? There was recognition that the default model might not give sufficient funds to all communities that have had various needs. And so this infrastructure share was designed to kind of supplement those other shares. And so is available through a competitively managed process by the Colorado Opioid Abatement Council. So as mentioned, right, so Colorado's model is really driven by these regions. So over 70% of the funds are being managed by these 19 regions. And so strongly encourage everyone involved with this work, whether you're working at the local government level, the state level, or the county level, or at the regional level, to kind of be aware of kind of this network and the partnerships kind of working across the state to invest these funds. So the MOU, so how does the allocation of funds kind of work? So first of all, the MOU does require governments to sign on to each of these settlements to maximize the funds received and to be eligible to receive those funds, right? So all of these 312 governments basically have signed on to each of these settlements. A couple of the small governments haven't signed on to some of the more recent ones, but for the most part, all 312 governments have signed on to each of these national settlements, except for a couple bankruptcy ones, which didn't require national sign-ons. As mentioned, local governments may redirect their funds to the regions to pool funds and reduce administrative costs. And we've seen the vast majority of local governments choose to take this approach. One of the main questions we often get is how is the funding allocations calculated? And so a lot of people often think it's on population. It's actually not based on population. It was based on the county area formula was calculated based off three factors. One, the number of persons suffering from opioid use disorder in the county. Two, the amount of opioid overdose deaths in the county, and three, the amount of opioids distributed within the county. So in the Colorado MOU, there is an exhibit, I believe it's exhibit D. I might be off by one, which details kind of the percentage allocation. So you can see kind of the state share, what portion goes to the city and county of Denver, what goes to the county of Pueblo, etc. And then in the next exhibit, which I believe is Exhibit E, there's then a formula for the intra-county area, which then breaks down kind of within the county area between the county and the various participating municipalities, how are those funds further broken out. And so that intra-county area was based on a model using census data. One requirement of the MOU is that 100% of opioid settlement funds be used for approved purposes. So basically, the national settlements have their own requirements for how the funds may be used. Most of them require approximately 85% of funds to be used for approved purposes. Some of them do require 100% of funds, but they vary generally. But the Colorado MOU goes further than that, and it requires 100% of opioid settlement funds to be used for approved purposes. One of the specters that kind of hovers over this work is the tobacco settlements back in the late 90s, in which there's kind of been a wide range of studies and assessments of those funds, which have found that the vast majority of those funds did not go to tobacco abatement. And so there was recognition as these settlements kind of came to fruition that there needed to be some greater safeguards. And so there are some at the national level, and then more locally at Colorado's level, as Colorado is more strict about the usage of these funds even than the settlements. And so the MOU kind of dictates that requirement of 100% of funds being used for approved uses, which is a list of approved uses set in Exhibit E, and which I'll get into in just a minute. That approved uses does include reasonable administrative costs, which are capped at 10% of the allocation. And these approved uses are so important because each expenditure of opioid funds must be identified with an approved use of funds when you are reporting. So when we talk about approved uses, what are they? And so you'll often see that there's this document called Exhibit E. There's actually two parts of Exhibit E, Schedule A and Schedule B. Schedule A just details kind of these high-level core strategies, but Schedule B actually lists the full list of approved uses. And so this is a list of over 120 different kinds of activities and strategies ranging across the continuum of care, really kind of getting at at abating the crisis from each section of the continuum. And so I want to show this graphic on the screen, which kind of is a wonderful graphic that the Denver Department of Public Health and Environment Development developed and shared. And this is just a great visualization of kind of the different sections of Exhibit E. And so basically, at the top level, you've got kind of these high-level categories of prevention, harm reduction, treatment, recovery, other areas, and planning and coordination. And so these are kind of these high-level bucket areas. And then in Exhibit E, these are all of the different sections that we then organize under those categories. And so each of these different sections kind of corresponds with a section in Exhibit E and has a range of different types of strategies and activities that falls under it, which are allowable uses of spending. You'll see kind of on the screen now the actually full detailed list of approved uses. So under prevent misuse of opioids, you see there are 13 different enumerated kind of types of strategies and activities that can be used, ranging from funding media campaigns to prevent opioid use to engaging nonprofits and faith-based communities as systems for support prevention. Then you can see kind of other areas of prevention include preventing overprescribing and ensuring appropriate prescribing and dispensing of opioids. That can be a lot of kind of training for healthcare providers, increasing electronic prescribing, providing support for non-opioid pain treatment alternatives. Other areas include harm reduction, right? Preventing overdose deaths and other harms, right? So kind of that includes distributing and sharing naloxone, increasing access, educating first responders, syringe service programs, and other programs along the like. We know treatment is a core part of kind of the intended use of these funds, right? The treatment of opioid use disorder. And so how do we expand access to medication-assisted treatment and other evidence-based, evidence-informed and practice-based services that meet kind of the treatment needs. We know addressing the needs of criminal justice involved persons is also a key strategy, right? And so we see a wide range of support for pre-arrest and pre-arrest diversion programming, co-responder programs, critical time interventions, and other kind of interventions in the to prevent and divert folks from the criminal justice system. Addressing the needs of pregnant or parenting women and their families with babies with neonatal abstinence syndrome is also a key area. Recovery, supporting people in treatment and recovery. So, right, providing the full continuum of care of treatment and recovery services for OUD. And connecting people to need help to the care they need, right? So we're funding screening expert systems, providing trainings, expanding services to navigators and on-call systems, etc. First responders is an allowable use as well for the education of law enforcement of other responders regarding best practices when dealing with fentanyl or other drugs and provision of wellness and support services for first responders and others who experience secondary trauma. As mentioned, admin, and then kind of finally this miscellaneous kind of category planning coordination, which right really funding the efforts to coordinate these efforts, right? The regional planning, the community needs assessments, training to support kind of behavior, the staff training and networking to improve the capacity of government, community, and not-for-profit entities to abate the opioid crisis. As well as research, supporting opioid abatement research as well, and monitoring, surveillance, data collection, and evaluation programs. So this is just, I'm not, as I just went through those very quickly, it is a very long list of different types of strategies meant to allow communities to use the funds to meet their localized needs across the continuum of care and to meet those unmet gaps. One thing I'll note is that most of these sections include kind of the support opioid abatement research that may include, but is not limited to the following. And so we also recognize that this is not an exhaustive list and there may be strategies that fall under these categories that might not be explicitly listed. And so if there's ever questions about approved uses, please do reach out to our team and the Colorado Opioid Abatement Council for guidance about allowable uses. As mentioned, law enforcement is kind of is an ongoing topic around opioid settlement funds. Supply side efforts such as drug interdiction or criminal law enforcement are not permissible uses of opioid settlement funds. All expenditures must align with the approved purposes outlined in the National Opioid Settlement Agreements and associated guidance, which, as you just saw in Exhibit E, that criminal law enforcement interdiction is not kind of included in Exhibit E. There is kind of, as you did see, though, there's kind of a range of strategies that do involve first responders and law enforcement professionals, and we do have a list of kind of curated of those approved purposes on our website. Administrative costs, right, are permitted, even though they're not identified in Exhibit E, that they are included kind of in the definition. So there's sometimes a question about that, but administrative costs are allowed and they are capped, but they are capped per the terms, 10% per the terms of the MOU. These apply only to costs associated with overseeing and administering opioid funds, such as grant and contract administration, fiscal oversight, management and accounting, and legal and audit services. One thing to note, these are not equivalent to indirect costs, right? These are actual direct costs incurred as a result of receiving opioid settlement funds. Supplantation, one thing we also want to kind of emphasize is that supplantation is not an approved purpose for opioid settlement funds. This is kind of from guidance that the Colorado Opioid Abatement Council put out earlier this year, which kind of really stresses that opioid settlement funds are to create, maintain, or expand, not supplant existing services. There's been national focus by watchdogs and media on supplantation by states and local governments. There have been some stories kind of in other states of which there have been kind of some quite egregious examples of supplantation. And so here in Colorado, that is not permitted. And so it's important that folks kind of review any funded programs and ensure that funds are not supplanting existing services. There's a fantastic guidance document that my colleague has dropped in the chat, which the COAC published earlier this year, which includes kind of a quick reference chart, which details how the Colorado Opioid Abatement Council views supplantation and kind of navigates it, right? We understand that sometimes funds are discontinued, especially as we see kind of changes at the federal, national, and state levels. And so if a grant is discontinued or funding is no longer available, right, funds can be used to maintain those programs. So there is some nuance to it. So please check out that guidance to really understand how the COAC views supplantation. Another kind of nuance around is interest. In December 2024, the Colorado Opioid Abatement Council determined that interest on opioid funds is also considered opioid funds under the Colorado MOU, and therefore, kind of as it is opioid settlement funds, it must be used for approved purposes. So all parties receiving opioid settlement funds are expected to report any interest earned and provide an explanation as to any expenditures of earned interest in the annual expenditure report. So just to emphasize, it is not forbidden to hold these funds in interest-bearing accounts. It's absolutely allowable to kind of hold these funds in kind of standard governmental kind of accounting practices that may incur interest. It's just required per the terms of the MOU and guidance of the Colorado Opioid Abatement Council that that interest be tracked and then used for approved purpose and reported on accordingly. So I've talked a little bit about the Colorado Opioid Abatement Council and referenced them. And so I want to talk just for a minute about what the Colorado Opioid Abatement Council is, as well as then spend a little bit of time on, I'll turn it over to Jamie again to talk a little bit about their guiding principles. So as mentioned earlier, the bulk of funds are managed by the 19 regional opioid abatement councils, right, which are made up of local government and employees and elected officials. Right, and so the city and county of Denver is Region 11, Mesa County is Region 13, and so on. Each of these regions had to develop their own composition of councils that is then overseen by the state Colorado Opioid Abatement Council. The state Colorado Opioid Abatement Council's membership is determined by the MOU, which is that Colorado Opioid Settlement MOU, and it is really in spirit of the kind of negotiation of the MOU being a partnership between state and local governments. The membership of the COAC is also half appointed by local governments and half appointed by the Attorney General. The local government appointees have to be kind of proportionally representative. So there's two from the Western Slope, two from kind of the I-25 corridor, and two from the Eastern Plains. And then the Attorney General appointees kind of there have to be two individuals licensed in SUD services, three with experience, and then one affected individual, with the Attorney General serving as the non-voting chair. So that kind of is the composition of the Statewide Oversight Council, which kind of is primarily responsible for the oversight of the regions and the infrastructure share. The 19 regions, as mentioned, kind of have their voting membership have to be elected officials or employees of the participating local governments in the region, but they're also able to have advisory members, which can be kind of engage a much broader range of stakeholders, such as treatment providers, recovery providers, harm reduction stakeholders, affected individuals, and other individuals have lived and living experience. And then the third group that I won't spend too much time on for today's call is the Opioid Crisis Recovery Funds Advisory Committee, which is a group, a body created by the legislature, which advises the Attorney General's office on the usage of that 10% state share. So as mentioned, not particularly kind of involved with the regions and the local government share, which is what kind of today's call is more focused on. But there is kind of this additional advisory group that helps to advise the state share, which includes representatives from a wide range of state organizations and different appointees, ranging kind of bringing together a wide range of stakeholders and subject matter expertise. So what does the Colorado Opioid Abatement Council try to do? And so their adopted mission is to responsibly maximize the impact of opioid settlement funds to address the opioid crisis in Colorado. We build stronger communities by applying proven strategies that support prevention, treatment, harm reduction, and recovery. And we share best practices, facilitate collaboration, promote transparency, and learn from one another to end the opioid crisis. So part of the model that Colorado has kind of really dedicated to is kind of a collaborative model between local governments and the state, and COAP continues to kind of live by this model with its mission and sees itself as a partner to local governments and the regions. And our team, as their administrator, for instance, puts on resources such as days like today to help kind of spread peer learning and to support local governments and regions in the usage of these funds. What are the COAC's kind of core charge and responsibilities? So they're really at the core is to ensure the distribution of the funds complies with the terms of the MOU. So the distribution of funds is set forth in those exhibits in MOU. And so, right, that we kind of work with the Colorado Opioid Abatement Council to ensure all distributions are done kind of according to those percentages. They are then also responsible specifically for the distribution and oversight of the regional share. So that's that 70% of funds. And so those funds are not automatically distributed to regions. Regions have to develop 2-year plans and submit them. And so the COAC is responsible for reviewing those 2-year plans and distributing funds to regions upon request. Similarly, the infrastructure share is overseen directly by the Colorado Opioid Abatement Council. And so that intended share that's designed to supplement the funds received by other parties, the Colorado Opioid Abatement Council is responsible for overseeing the process by which those funds are awarded. And so to date, it has awarded about 9.4 million through 3 competitive rounds. And there's a fourth open competitive round currently open, which we'll touch on a little bit later, with 11 million available. And finally, the COAC is also responsible for ensuring expenditure data collection and publication. And so one of the requirements of the MOU is that 100% of funds every dollar expended be reported on annually to the Opioid Abatement Council and be made accessible on a publicly accessible dashboard, which was launched a couple of years ago. So I've got one slide for ROACs here, and so I know we've got audience members who are from regions. John, so their role is not technically an oversight role of the local government share. They are responsible for the distribution and oversight. All parties have kind of an oversight role kind of to the local government share. So it is kind of a little bit nuanced. And so their primary role is to focus on the region and the infrastructure share, but the local government share, they kind of have that distribution role. And then kind of as representatives of the local governments in the states that all have an oversight role in ensuring the local government share is used appropriately. Um, so the regional opioid abatement councils kind of have in addition, kind of as with all parties, they have a responsibility to ensure the use of funds complies with the term of the MOU. They need to maintain their compliance with their regional governance structure. So each region had to self-formed a couple years ago. And so each of them needs to comply with their governance structures that are made up of representatives of all their local governments. They need to engage with subject matter stakeholders and educational opportunities. They have to develop and implement 2-year plans. They have to establish processes and procedures to release funds with their fiscal agents. They have to implement oversight processes to track funds and assess impact. And then they need to report on their expenditures with those annual expenditure report submissions. So this is just kind of a very high level summary of the kind of core charges that the ROACs have. The local governments, quite similarly, just a little bit simpler, just without those 2-year plan and regional governance structure requirements. But similarly, right, there's that kind of responsibility to engage subject matter stakeholders and educational opportunities to ensure that distribution of funds complies with the terms of the MOU, establish processes and procedures to release funds, implement oversight processes to track funds and assess impact, and finally, to submit expenditure reports. So I'm going to turn it over now to Jamie Feld, our Director of Opioid Response, to talk a little bit about the Colorado Opioid Abatement Council's recommendations and guiding principles for the use of opioid settlement funds.
Great. Thank you, Jack. I'd love to see too from folks if you're willing to put in the chat if you're a representative from the local government share or the region to give us a better sense of who is in our audience so we can better target this. If you're willing to put in the chat whether you're a representative from the region or the local government. Great. Thanks all. So here we have from the Colorado Opioid Abatement Council recommendations and guiding principles. As Jack mentioned, the Colorado Opioid Abatement Council is composed of both local government and state-appointed representatives. From the state-appointed representatives, those are subject matter experts, including individuals with lived experience who have a decision-making component on the council. Together, they are very highly functioning. We're really grateful to have such a collaborative group of individuals. They put together the following recommendations back in 2024 and reiterated their commitment to them in 2025. These principles are based off of the principles for the use of opioid settlement funds from Johns Hopkins School of Public Health. As I'm sure you all have heard, Colorado was the inaugural state recipient of the Principals Award for use of opioid settlement funds. The council did look at these principles and tailor them to a Colorado approach. And so we'll go through them quickly today. And thanks everyone for putting in the chat um, where you are based. So the first one is spend the money to save lives. In the Colorado MOU, it does explicitly state that funds must be used for forward-looking opioid abatement strategies. In addition to that, the COAC went on one step further to say that supplantation is not an approved use. And you may ask, what is supplantation, right? And so Jack mentioned we do have a great guidance document that we are getting requested from at the national level. I like to say it's one of the few policies that I've seen in a national news article. Even our state folks are looking at it because it has some guides about what to look for supplantation, particularly in these times that we know have really significant funding cuts. Um, but we know that, many people talk about this as blood money. My sister is in recovery. It's really crucial that we're ensuring that the money that is being spent is used to save lives and to make the biggest impact. With that, we talk about appropriate staffing and operational tools for management of funds. There was a lot of discussion about what does appropriate mean, and that may look different for each community. Um, we believe in local control for these funds with state support. So even for our office, we're a fairly lean team because we want to ensure that the funds get out to communities. However, there is recognition that planning, training, and capacity building is necessary and can be greater for rural or underserved communities and is thus an allowable use. I'll move forward, but feel free to put in the chat if you have any questions. The next one is use evidence for overdose prevention and improved health outcomes. One area that's important is to build off existing community needs assessments. Most local entities will have local public health agencies that perhaps have developed a public health improvement plan specific for behavioral health. Additionally, you will have access to your regional area entity and newly formed Behavioral Health Administrative Service Organization area, or BOSO. So one key starting ground is to work with those existing efforts or coalitions on substance use prevention to identify what funding gaps and needs remain. We also, the COAC recommended implementing evidence-based, evidence-informed, or practice-based approach. We have a strong evidence base for what works for opioid prevention. On our resource website, we do have a variety of different national documents on this front. There's a strong evidence base around the effectiveness of medications for opioid use disorder, naloxone, and other efforts. And then we also, the COAC recognized the importance of evidence-informed or practice-based approach. So these approaches are that we know that for some communities, culturally appropriate responses might not look like the randomized controlled trial. So there was a recognition by the Colorado Opioid Abatement Council around the importance of culturally based or practice-based approaches. And next, the emphasis on community-led and community-based efforts. There is a link that my colleague will put in the chat around the importance of community-based services and why it's crucial that we ensure that funds are getting to those that can most effectively serve marginalized or stigmatized populations that may have less trust with governmental entities. And then finally, partnering with local and state initiatives. And I think if we, yes. So we have an opioid data response work group that had been meeting, and we now have a packet on our website that includes their recommendations for both state and local data efforts. So we look forward to continuing to partner with you all as local and regional entities, as we know it's critical to evaluate the effectiveness of these funds. Next slide. So we know there's also no single bullet to addressing the opioid crisis. Jack went through the approved uses, which are required for the use of opioid settlement funds. So it is necessary to distinguish which approved use you are using funds for. And as he mentioned, these fall along the continuum of prevention, harm reduction, treatment, and recovery. There was also a Colorado blueprint that came out that indicated the importance of investing in all of these areas to have a robust response. There are a variety of different technical assistance resources out there. I know if you're new to this topic, this can all sound like jargon. So we want to be able to partner with you and provide resources. There are some different resources from NACO and also from entities in Colorado. We recently distributed a Colorado MAT toolkit that was funded from opioid settlement funds to provide resources specific to Colorado. We'd also like to highlight, if we go back one, just the core strategies. So it was referenced Schedule B, which is the long list of approved uses. There's also a core strategies list, which is Schedule A, and these tend to be those that have a stronger evidence base. We don't talk about them as much, but they're good to reference in terms of a first starting point about what to focus on in your community. And then finally, the focus is on equity. So incorporating the voice of effective individuals in the decision making and management. There's also a link that Natalie put in the chat that talks about how to engage with people with lived experience. That was a focus of our conference. We recognize that those that are closer to the problem are often those that are closer to the solution. As our council member Raquel Garcia states, and so we have really emphasized the importance of that in the work. Also, to address structural inequities. So, a longtime concept in public health is addressing social determinants of health, whether that be housing or transportation. We know that there are really a wide variety of factors that lead to worse health outcomes for marginalized communities and incorporating an intersectional approach to health equity. I do want to reiterate this because the council, which comes from both rural, urban, under-resourced communities, really stated collectively that they wanted to reiterate the emphasis on equity. That was a term that they wanted to continue to use because of the importance of this value. We do know, again, that some of our rural communities are most impacted by overdose death rates, lack of resources. We also know that while we have a decrease in overdose death rates for the general population, some communities, particularly our indigenous populations and Black Coloradans, have an increased rate of overdose death rates in the recent years. And then Jack talked a lot about these components about a fair and transparent process for spending funding. Those are a lot of what we're talking about today, right? Strong controls for accounting of opioid settlement funds. If it's possible to put it in a separate account in terms of managing these funds and ensuring that they are kept separate from other county or municipal funds. If not, how do you track that those funds are being used specifically for opioid settlement funds, and what is your tracking mechanism? As he will talk about, we do have expenditure reporting on an annual basis. Adopting records management and retention policy. Jack will also talk about that, but that is an explicit requirement in the Colorado Opioid Abatement Council and in the MOU. And so there are some requirements to maintain and retain your records. Establish transparent council operating policies. I think a lot of you have really done a lot of work around creating bylaws as well as posting them online, following the state requirements for open records and open meetings. And then, as mentioned prior, it is a requirement that all interest accrued on opioid funds be used for approved purposes. So that is a requirement that came out of the COAC. We just wanted to be very explicit about that. So with all these resources, again, the intent is just for clear and effective communication from the council. We welcome feedback. It is ongoing and iterative in terms of these recommendations. And we welcome feedback about how to make it most effective for your local and regional level. So I'll turn it back to Jack.
Thanks, Jamie. So as mentioned, kind of with the COAC size, one of the requirements of the COAC responsibility, which is the Colorado Opioid Abatement Council, the statewide oversight board, is to ensure kind of 100% of opioid settlement fund expenditures are publicly reported on an accessible dashboard. And so, right, all recipients of opioid settlement funds must submit annual expenditure reports to the Colorado Opioid Abatement Council. So that's regardless of the state share, the regional share, the local government share, the infrastructure share. All parties have to submit to the Colorado Opioid Abatement Council. So the Colorado Opioid Abatement Council does have kind of oversight over all shares through that approach. So those one thing, as mentioned earlier, kind of and emphasized again and again, is that all expenditures must be reported by the approved purpose. Right. And so that's why it's so important to have that familiarity with those list of approved purposes, because expenditures should be reported under the most specific approved purpose in Exhibit E as feasible. Expenditure reports are submitted annually in February, which covers and it will cover the previous calendar year. So this year we just sent out notice just last week regarding the February 2026 expenditure reporting deadline, which will be February 13th. And so this will cover all expenditures of funds through 12/31/2025. Reports are set for local governments and regions. The reports are submitted through the Colorado Opioid Settlement Tracker portal, which is known as COST. So if you have kind of new representatives from your local government or your region that need access to this portal, this is where you can access information about your funding allocations. For regions, this is where you can see and modify your 2-year plans. And this is also where you will submit your expenditure reports that will be due in February. We will be updating kind of our FAQs. So Natalie's going to drop in the chat kind of our FAQs that we have developed and published for each year's of expenditure reporting. So you can see kind of our 2025 edition of those. And so we will be reviewing those in the next month and may make some small edits, but it's a great resource for now in terms of understanding kind of the core requirements around expenditure reporting. And I'll touch a little bit on that in the next slide as well. We'll be hosting some additional webinars specifically about expenditure reporting, as well as office hours in the month ahead of expenditure reporting. So we anticipate that expenditure reporting will be live early January, and we'll be providing support throughout the month of January and the first half of February to help regions and local governments get those reports in. What is required for those expenditure reports? So an accounting of any expenditures of opioid funds for each funded program or activity categorized by approved purpose. So what's that saying? Basically, all the various expenditures that you have associated with a funded program. So let's say you funded a co-responder program in your community, you would report all the associated expenditures with that program as one expenditure. And so you would then identify the approved purpose, which co-responder is a specific approved purpose. You would provide a brief 80-character program or activity name. So for instance, City of Lakewood co-responder program. You then provide a brief description of how funds were used, up to 300 characters. So you would detail kind of the specific costs, such as types of employees kind of paid for certain materials and supplies, whether indirect costs included, that kind of thing. You would then identify any subrecipients, so that might be the Lakewood Police Department. And then you can also add a web page link to learn more about the program. So that's just one thing to increase accessibility, is that you can share kind of a link to for where folks can learn more about the specific program. Um, you'll also be required to provide an accounting of interest recognized during that reporting period on opium funds, and to provide a description of the past or intended use for any interest recognized on opioid funds. So what you may notice here is that there's not a requirement to submit supporting documentation as part of the standard expenditure reporting process. You just have to report kind of at this high level. You are required, per the terms of the MOU, to maintain records related to the receipt and expenditure of these opioid settlement funds for years, and you must provide those upon request by the Colorado Opioid Abatement Council. So the council can ask those reports. In fact, any local government or region can request those as well. So always be kind of maintaining those records related to all your expenditures of opioid settlement funds, and be prepared to provide those upon request, but they're not required as part of the expenditure reporting process. So what do the expenditures look like once reported? So this is just a slide. We just kind of pulled some examples of past reported expenditures. I've omitted the actual amounts from the slide, but there you can see, for instance, this was a statewide Connect Effect fentanyl awareness campaign for youth 10 to 14 and trusted adults. We provided a brief description of how we spent those funds, for a brief on development of target prevention campaign, research development, paid media and materials. We identified the subrecipient, the approved purpose, and we provided the website. And so this is kind of at the high level how the expenditures will then show up on the dashboard. And so you can see, for instance, effective family support program, community court navigator. So this is just one way by which we try and make the expenditure data accessible both to the stakeholders, to the Colorado Opioid Abatement Council, but also not create too great an administrative burden for local governments and regions in submitting these expenditure reports. So all kind of your expenditures for the calendar year should be reported on this. So this is the link to the dashboard. And so I highly recommend you kind of check out the dashboard, as this is where you can see where all kind of reports of all expenditures to date. This is a little bit out of date, but you can see kind of on one page, you can see how all the regions have allocated their plans. So you can see kind of the largest categories. So you can see kind of on the right that treatment and recovery have generally been the largest categories of investment, followed by prevention, harm reduction, and planning and coordination. So you can check out our dashboard to learn more about how all those 19 regions have allocated their two-year plan in their two-year plans. So it's not just expenditure data that is on this dashboard, but you can also see the region's two-year plans. But then you can also see that actual expenditure data. So through the end of 2024, we had over 44 million in actual expenditures. We also show committed expenditures, so it's optional to report on those committed expenditures. By default, regions show their planned expenditures as committed expenditures. And so you can see there's also kind of details on additional 94 million from last year. And so this will be updated, hopefully kind of May or June of next year, after we go through this next round of expenditure reporting. So the final thing I want to spend a little bit of time on before we open up questions is about those two other shares, right? We spent most of the time talking about the region, the local government share, and kind of the management of those. The other two shares, right, are the 10% state share received by the Attorney General's office, and the 10% infrastructure share, which is overseen by the Abatement Council. So the 10% opioid settlement state share will primarily be used to fund programs of a statewide effort. It supports the work of our team, the Opioid Response Unit, as well as we provide funding to the two federally recognized Colorado tribes. The use of these funds is advised by that Opioid Crisis Recovery Funds Advisory Committee. So far, there's been over 18.6 million awarded to date from the state share funds, and you can see details to this on the dashboard as well. You can see it there, and as well as approximate estimate of how much funds will be expected to receive for this share. And then I'll come back later on the state shares that we do have a concurrently open state share funding opportunity. More relevant a little bit to this, local governments and regions, is the infrastructure share, which is that other 10% overseen by the Abatement Council. The purpose of the statewide infrastructure share is to promote capital improvements and provide operational assistance for developing or improving the infrastructure necessary to abate the opioid crisis anywhere in the state of Colorado. The statewide infrastructure share is intended to supplement opioid settlement funds received by any party or region. So, right, so the only parties receiving opioid settlement funds are the local governments, the regions, and the state. And so this share is really intended to supplement and support the local governments and the regions, as well as the state, in utilizing their funds and maximizing the impact of these funds overall. The infrastructure share has kind of similarly only has those three eligible entities as as being eligible to apply for funds. So, but non-governmental entities such as nonprofits are eligible to be part of collaborative partnerships in those applications. But those applications are solely limited to be derived by the regional opioid abatement councils, participating local governments, or state of Colorado agencies. And so this is kind of currently there's over 70 million projected to be available through this fund through 2038. There's over 9.4 million awarded to date. Here's just a quick graphic that shows kind of awards kind of being across the state. So you can see round three on the left and rounds 1 through 3 location awards across. And you can go to the Colorado Opioid Abatement Council's website to learn more about the previous awards, and also, more importantly, is to learn about the currently open funding opportunities. And so this is right now, there are funding opportunities from both the statewide share and the infrastructure share. So the infrastructure round 4 infrastructure funding opportunities open with 11 million in total available funding through the Department of Law. The Resilient Colorado grant, Department of Law Resilient Colorado grant is available with 12 million in total funding. The Department of Law Resilient Colorado grant has a kind of more focused funding priorities, which are identified here, these 6 priorities, whereas the infrastructure share is a bit broader and so kind of in serving capital or operational investments, prioritizing rural or underserved and or disproportionately impacted regions or communities of Colorado. Um, so the upcoming, here are the key dates and deadlines for the statewide funding opportunities. So that's Department of Law Resilient Colorado grant closes next week on December 16th. December 18th, and then the infrastructure share closes on January 14th. With the deadline of notice to apply is actually coming up next week on Monday, December 15th. So highly recommend that you all kind of monitor that. There will be additional funding opportunities for sure through the statewide infrastructure share. So please kind of keep this on your radar as an additional funding stream available to you all. As we close up, one thing we want to note is we host a annual conference, which we've just hosted our 4th year, which we had over 500 attendees. This is a great conference to learn more about how opioid settlement funds are being managed and used across the state, learn about kind of best practices for implementation, and network and engage with various stakeholders engaged in the work. And that is kind of the end of our spiel. So we've got about 8 minutes left for questions. So as mentioned, kind of highly recommend checking out that COAC webpage to learn a little bit more about that infrastructure share, as well as other resources. We also have a newsletter which goes out regularly with other updates and resources. So highly recommend signing up for that as well. I'll leave these QR codes on the screen just for a minute. And then I think we can open up for questions. And I apologize for the rapid fire. We had a lot of information to get through in that call, and so appreciate your attention as we ran through all that information. One thing I wanted to note, which I realized wasn't included, was missing a slide, is that the opioid settlement funds are managed by, are generally paid out to a firm called Brown Greer, which is a third-party administrator. And so nearly all opioid settlement funds are paid directly to this third-party administrator and then directly paid to the local governments and the regional fiscal agents. And so usually the state of Colorado is not involved in the actual direct distribution of funds. We, as the Department of Law, work to with that third-party national administrator to distribute the funds directly to local governments and regional parties. So I just wanted to clarify that in case there was any question about distribution of funds.
Jack, do you want to share how the slides will be shared?
Yes, so we will share the slides out with everyone who registered. We will send out kind of both the recording and the slide deck out to all folks early next week. Well,
We'd love to
see.
hear too if there's any questions that we didn't get to or components that you think would be important to include in future sessions. As mentioned, we want to provide a couple of these for folks that weren't able to attend today. So if you're thinking of colleagues that could benefit it, a couple of audiences we're thinking about is definitely local governments. We do have a regional learning forum, so we regularly communicate with the regions. But we don't have something analogous right now for local government. So local government representatives, we want to keep them appraised before the expenditure reporting comes out. Also, new regional council members that just want a 101 about what are the opioid settlements. Those are some audiences. So thinking about those folks, we'd love to hear any reflections about what could be added.
I just think continuing these, webinars and whatnot, and for local participating governments and any new members is highly beneficial. We do get new members coming in, then, the actual regions don't have to spend as much time on all of that. If there's, even just a recording of this that we can share with our new members would be so beneficial for our region, I know for sure, and I'm sure for other regions.
Yeah, we will be sure to share out the recording next week, Alex. So we'll please feel free to share that recording broadly with your regions and stakeholders, and we'll be sure to kind of host additional calls in the future as well.
Perfect. Thank you.
And we'll continue to narrow it down and gather feedback about how to communicate to these groups. We know multiple methods. You all are very busy. We really wanted to highlight particularly a couple of components that were new. So one of them was around the local government approved uses. So that is a component that was a communication that went out fairly recently to all local governments and regions, saying that supply side efforts such as drug interdiction or criminal law enforcement are not permissible. That was a determination from the COAC, which is actually composed again of folks from rural, urban, quite a few law enforcement folks, and they just said that they thought it was valuable to have really clear guidance. So we're really happy to provide that more clear guidance out. So that is a new component. And then fairly recent is the component on interest, that all interest must be used for opioid abatement approved purposes, and the guidance on supplementation, that supplementation is not an approved purpose. So we wanted to be really explicit about that. As many efforts as you can share those resources out is helpful. And then the expenditure reporting coming up soon. So that's going to be, coming up quick along with all your other end of the year deadlines. We know it's a very busy time of year, but it is on an annual basis. We try to postpone it as long as possible to give you as much time, but we do have to report to Mallinckrodt, which is one of the defendants, and that's why we do have to put that deadline in February of reporting. So if you're a local government, this is one of probably the bigger lifts on your end on an annual basis, having to report this out. We wanted to give you advance notice. So that also went out in the communication around that February deadline. I'll have Jack put in the chat the exact date. But we would try to put it as far out as possible that we could still meet our deadlines and requirements to report to the national administrator. Are there any concerns with meeting that February deadline for expenditure reporting? Thanks, February 13th. Friday, February 13th, is that right? So we didn't want to do it on a weekend, but that's a way you can remember it, Friday, February 13th. Does anyone have concerns with meeting those? I'm taking that as not, but please reach out to Jack at opioids@coag.gov. He can walk you through the process of our portal. Hopefully, it will be familiar for you all, but we're trying to work with our Salesforce team to make it as user-friendly as possible. I'd say we're not there quite yet, so thank you for your work on it. But it is really critical that we've always gone 100% reporting by that February 13th deadline. And we'll put in the chat too. Colorado is leading because we do have this 100% commitment to transparency. Um, and you all being so good about meeting this deadline is how we're able to maintain that commitment. That's a requirement of the MOU.
Well, I think we're right at time now, so I just want to say thank you, everyone, for joining us today. Really appreciate you taking time in the holiday season on a Friday to join us for a discussion about overview of compliance requirements and overview of MOU and settlements. So appreciate you all diving in, and please don't hesitate to reach out if you have any additional questions. We are here to help. And as mentioned, a couple deadlines coming up with both infrastructure and state share funding opportunities, as well as the expenditure reporting deadline coming up in February, as well as for my regions, that plan amendment deadline of January 13th. So please don't hesitate to reach out if you have any questions, if we can be any assistance. Otherwise, we'll wish you a very happy holiday season and hope to see you all in the new year.
Thanks, everyone.
Thank you.